I think it is very important to know how to do this, because there's no real point in managing a condition if we don't know whether we are doing well at it. So he's talked you through it, and I think everyone needs to understand this, and everyone needs to have their own home blood pressure monitor so that they can check their blood pressure at home in the comfort of their own home, and they need to do it well so that we know that the control measures that we are advocating are working. How to treat high blood pressure if you have high blood pressure. A lot of the information is gathered from different what we call society guidelines. So this is the ESC/ESH, which is the European guidelines. And you can see that pretty similar to all the other different national guidelines. What they do is we group people into groups depending on what your blood pressure is. So there's high normal blood pressure. This is grade 1 high blood pressure, grade 2, grade 3. Don't really need to know all these numbers really, but suffice to say, the first step in managing blood pressure that is high is always lifestyle. So you see over here, lifestyle advice is always the first step. And then after that, then we start talking about things like drug treatment. And if drug treatment doesn't work, then maybe something else. So these are the lifestyle modifications that we normally talk about when we are trying to target blood pressure. So we want to lose weight, we want to do some regular exercise. Salt in the diet is so-called the enemy, so you want to reduce salt. You want to moderate alcohol if you are a drinker, and you want to stop smoking. And then in terms of the food that you take, you want to moderate all the portions, and you want to increase the proportion of fruits, vegetables, as well as low-fat dairy products. All over here on the left, you can see this is the advice with regards to activity. So for overall cardiovascular health, so cardiovascular health refers to things like heart attacks and strokes. What they actually recommend is at least 30 minutes of moderate intensity aerobic activity. So that's like brisk walking for at least 5 days a week. Or if you want to do fairly vigorous aerobic activity like a slow jog or a jog, then at least 25 minutes, maybe 3 times a week. And then you want to do that in combination with a little bit of muscle strengthening activity. So it could be stretching, lifting up some weights, etc. And if you want to be targeting specifically blood pressure and cholesterol levels, then actually an average of 40 minutes of moderate to vigorous intensive aerobic activity for about 3 or 4 days every week. That really is a so-called bare minimum that we are encouraging people to do. For some people, really it's a challenge, because you need to try and factor in your lifestyle. You're going to work, you need to look after the children, you need to do your housework, etc. But really, there are ways to try and build this in, incorporate this into your daily routine. So I think you've all heard about how some people will get off the bus one bus stop earlier so that they can walk that extra bus stop before they get home. Or sometimes people don't take the lift anymore. They take the stairs to their office. So for instance, like myself, my office is actually quite high up in the building. I try to take the stairs as much as possible. Sometimes if I have the opportunity, then maybe I'll run home from work. So it really depends on how you want to try and incorporate this into your daily routine. Now on the right here is about sodium. So sodium is basically salt, right? Table salt. So this is American specific, but you can see 9 out of 10 Americans consume too much sodium. And unfortunately, here in Singapore, the ratio is probably not that far off. So where does all this sodium come from? A lot of it is from processed foods, restaurant foods. Some of it is what we add when we cook. And then sometimes, of course, all foods have some sodium, right? So because all foods have some sodium, you really don't need to go and add more sodium to it. I'm not saying that you want to make your food totally bland, but there really are better ways or alternative ways of trying to get your food tasting more tasty. So you can use things like spices, you can use herbs, etc. And really the key here is to try and limit all the processed as well as restaurant foods, all the takeaways, all the deliveries that we are now having to do because of these very unique times. And this is very important because we know that actually excess levels of sodium or salt puts us at real risk of things like kidney disease, heart failure, high blood pressure, etc. This is from the American guidelines. They are really very detailed. And basically what it shows is that if you do all these lifestyle changes here on the left, you can expect some gains with regards to reducing your blood pressure. So we talked a little bit about the exercise thing already. This is your diet. So diet rich in fruit, vegetables, and low-fat dairy products. If you do these two together, there's a good chance you're going to lose some weight, and losing weight also reduces your blood pressure. We talked about the sodium, and for people who who take alcohol, then you really should consider moderating your alcohol intake. So for men, it's really less than 2 drinks a day, and for women, less than 1 drink a day. And of course, it'd be good if you had days where you were abstinent as well. So then sometimes, of course, lifestyle is lifestyle, but as you saw in that graph I showed you just now, a lot of times lifestyle is not enough. Okay, your blood pressure comes down a bit, but maybe not enough, and maybe you want to have more blood pressure lowering because you know that the lower your blood pressure is, then the better your outcome in terms of heart disease as well as stroke. So then you need to supplement with some medicine. The question I always get asked is, hey doctor, can you please start me on the best medicine? So the thing is, the best medicine really is the medicine that you will take. So this really depends on your preference, right? So some medicines cause people to have some side effects. Some people don't like certain shapes of medicine, too big, too small, etc. Some people don't like twice a day medicine. So really the best medicine is something that you need to discuss with your doctor about how it fits in with how you want to be taking medicines. And at the end of the day, all the medicines actually work really very well. But having said that, most people actually need 2 or 3 types of medicine. This is what the Europeans actually recommend. There's a few different classes of medicines. Like I said, they have some specific classes. They actually do recommend using pills that combine the 2 different drugs. This really has the advantage of lowering the number of pills that you have to take in a day, and also makes it more likely that you will take medication in the long term. So really discuss with your doctor about what is most suitable for you. And of course, this thing can change as you and your body changes over time. So don't always think that, oh, I've been taking this medicine for 10 years and it's not, I don't feel great on it. I have no option to change. So how come medicine not working? There's a whole variety of reasons. Okay, so adherence means, are you taking your medicine? Okay, so maybe it's tough to take your medicine because you're working, right? So maybe then you want to be asking your doctor, can I, instead of having 3 times a day medicine, can I have a once a day medicine? Can I combine some pills so I don't have to take so many pills? Maybe the medicine doesn't really fit you. Yeah, okay, you don't like it, the taste is funny, you get some side effects, then you need to change it. Sometimes the dose of the medicine is not enough, right? So if you take too little of a certain medicine, then it's not going to get the effect. And then, of course, there very rarely, as Dr. Rizwan has said, sometimes there are some other causes for high blood pressure. But in general, I said most of the time, medicine will work. Now, if it doesn't work, previously we didn't really have many options. But nowadays, we do have some further options. I'll just mention these very briefly because they are not things that we do commonly. So it's been almost 10 years ago now that we did this first procedure for lowering blood pressure, and this was what we call an invasive procedure. What we did was that we put in a catheter into the blood vessels that bring blood to the kidneys. And the reason for doing this is because there are some nerves that run around this blood vessel, and these nerves have been thought that when they are overactive, they tend to raise your blood pressure. So by doing a procedure like this, we hope to reduce the blood pressure by reducing the activity of the nerves. And you can see in the right here, this is just what we do. This is an X-ray diagram. We put in this wire into the blood vessel, and then this is the catheter or so-called tube. And then from there, we deliver some electrical energy. You have to eat a healthy diet. You have to do exercise, etc. And you may not get to that magic number, but it doesn't matter. Okay, as long as you try and bring it down as much as possible, we hope that you will have the best chance in not getting one of these nasty things like a heart attack or a stroke. So with that, I end my talk and we can take some questions. Thank you very much.